terms of sequencing, the next area we'll commonly look at after ensuring that the person has sufficient stability and control through their feet, ankles, and their lower body in general is that we'll start to look at the torso. And we'll look at a few key things in through that person's torso and assess how well they're moving through that area before we move on to the shoulder blade and the shoulder itself. So, in many cases, we'll have people that are slightly rounded forward and have a slight C-shaped pattern, where an excessive C-shaped pattern, we should have a little bit of curvature through our mid-back that resembles kind of a C, but we will get people where they have an excessive amount of rounding through that mid-back and through there. And then it just makes it hard for the actual shoulder and arms themselves to go all the way up and overhead, especially for a full lockout position on some of our overhead movements like the overhead press, military press, clean and jerk, as well as the snatch. So when we're looking at and assessing the movement through the middle part of the back, a lot of times we'll use what's referred to as the wall test. And so I'll have somebody stand up next to a wall with their back up next to the wall. We'll have them gently flatten their lower back a little bit against the wall, not all the way, since we should have some degree of extension or reverse curve down through the lower back. But we'll see when they do reach up and overhead, if this C-shaped portion of the spine starts to straighten out a little bit more in through here, and if they're able to ultimately take their hands and bring their thumbs back to touch the wall or to get close to touching the wall back in that position. If they are not able to do that, or if they have to compensate significantly to get there, a lot of times we'll see that people will create excessive movement through their lower back, or they'll crank on their shoulders and create an excessive amount of movement through their actual shoulder joint itself, rather than straightening out the mid-back and getting enough extension through that area. So if we do notice that, a lot of times that will create lower back pain or shoulder pain, and then we'll get that person started working on some extension exercises, trying to improve mobility back into more of an extended or a straightened position through the mid-back. And a lot of times that'll start to clear up and improve some of the other mechanics in the shoulder as well as in the lower back.